Moments in healthcare that leaders rarely see are often the ones that patients remember forever. That call that delivered the life-changing news, the silence after a diagnosis, the moment someone feels heard or dismissed. Those moments shape how patients interpret their entire journey. And leaders, they can't personally control every interaction, but they can design systems that support caregivers in those moments.
Welcome and hello. I'm Chris Malone, and I'll be your host for today's discussion. Thank you for joining us. Before we begin, I'd like to welcome PRC as our new program partner in the Humanizing Healthcare program. Today, joining us, we have Lori Speaks, Senior Vice President of Client Success at PRC. Welcome, Lori. What can you tell us about our guest today?
Thanks, Chris. Today, we have Stephanie Abbott, who's a nationally recognized healthcare leader, author, and former Chief Experience Officer, known for her work transforming patient and workforce experiences in large health systems. During her career, Stephanie led enterprise-wide experience strategies at Adventist Health, where she helped embed compassion, connection, and service excellence across hospitals and care settings. Her leadership is focused on aligning culture, leadership behaviors, and operational design so that patients, families, and care teams experience healthcare as more human, respectful, and supportive. Stephanie brings a distinctive perspective to healthcare leadership, shaped not only by her executive experience, but also by her personal journey as a cancer survivor. Today, she writes and speaks about leadership, resilience, and the human side of healthcare, helping organizations rethink how culture, relationships, and lived experience can transform the care delivery. Stephanie, welcome to the program.
Great to be here.
We would love to hear the story of your career. How did you choose a career in healthcare, as well as your journey through several different patient experience roles? How did all that come about?
My father inspired me to pursue a career in healthcare operations. I always knew I was going into healthcare, but my goal at that time was pretty straightforward. I planned to work my way through operations and eventually become a hospital CEO. But along that way, I became fascinated by something different. I noticed that two patients could receive the exact same type of clinical care, but walk away with completely different experiences. One might feel safe and respected. Another one might feel confused and unsure if they trusted the system. That gap stayed with me, and it led me into leadership roles focused on patient experience, consumer experience, employee experience at organizations for-profit, not-for-profit, faith-based, not faith-based, rural hospitals, large tertiary health systems. We like to think we're terminally unique in healthcare, but we're not. But over the time, I really realized that patient experience, it's not about hospitality. It's about how the system functions. And at that point, I was studying healthcare from the leadership side, but I had not experienced it yet from the patient side.
You've had the rare experience of being both a healthcare executive responsible for patient experience, but also as a cancer patient yourself. How did being on the receiving end of care change the way you thought about patient experience leadership?
I didn't realize the knowledge gap that had existed in myself before I became a patient. Because before cancer, I understood patient experience intellectually. After cancer, I understood it emotionally. When you become the patient, you experience something totally different. You experience those spaces between the operations, between the processes, the tone of voice when a diagnosis is delivered, the delay in a return phone call, the look on a nurse's face when they enter the room. Those moments are rarely measured, yet they shape trust. What I realized is that patients don't experience healthcare in these isolated encounters or these episodes of care. They experience it as a journey made up of hundreds of micro moments. When leaders start seeing that system through that journey lens, it changes everything about how we should design care.
What were some of the highs and lows of your journey through care? What were some of the dynamics that popped out to you along that journey for you personally?
The navigation access at the very beginning was quite difficult. They say that cancer patients that have the best mortality rate complete care within 365 days of diagnosis. And it took me 63 days to know if I was going to live or die. So that's 63 days of sitting there trying to be a mom, trying to work and not knowing what's going to happen. And then it took me 83 days to actually start treatment. And when we look at that 365-day window, I missed it by about 3 weeks.
Wow.
And the reason why is because of how it was designed.
You've spoken about healthcare evolving beyond simply patient-centered care towards more of a deeper partnership between caregivers and patients. What does that partnership look like inside hospitals and health systems in your view and practice?
Early in my career, much of the conversation in healthcare centered around the physician experience or designing care around the provider. And over the time, the industry has shifted towards patient-centered care, recognizing that patient's voice should guide how care is delivered. Like, genius idea. Today, the conversation is evolving again towards something deeper, the human experience. And what we're realizing is that patient experience can't coexist without employee experience. That true partnership really begins when healthcare moves from beyond doing care to patients and starting designing care with our patients and with our staff. Because patients bring lived experience. They bring their fears, their values, their goals. Clinicians bring clinical expertise and knowing how the system actually functions. So when those perspectives come together, care improves.
And it suggests that there are some perhaps gaps in the way that care delivery systems are designed now, if it hasn't had the benefit of that patient perspective, essentially. Is that what you're finding as well? Yes, there's the people part of it, but the process part of it is equally important.
Healthcare, we're really good at getting creative with the resources we have, right? We act in the moment, we fix the problem in the moment, but a lot of times we put Band-Aids on processes and then we do these workarounds that end up taking more time and then it burns us out.
Many healthcare organizations have invested in patient experience initiatives, but their culture doesn't often change. What have you learned about the difference between kind of implementing PX programs and really transforming culture?
Leadership sets the tone for everything in the organization. I remember I sat in a board meeting once and I said, well, the fish rots at the head. It didn't land particularly well in that moment, but the point was true because culture is not changed through programs. It's changed through leadership behavior and operational design. Many organizations, they launch patient experience initiatives that focus on training and service standards. Now, those efforts, they matter very much so, but they rarely address the underlying system pressures that caregivers are facing every day. If clinicians are rushed, if they're overwhelmed, if they're navigating broken processes, compassion becomes harder to deliver consistently. So the organizations that truly transform experience, they redesign the environment that caregivers work in. They reduce the operational friction, they support communication, they create that psychological safety. When the system supports caregiver, compassion becomes more sustainable.
In PX, healthcare organizations focus a lot on experience metrics and surveys, as you mentioned. How can leaders ensure that those measurements are driving learning and improvement rather than just creating more pressure or other unintended consequences?
Experience metrics are valuable, but they're often interpreted too narrowly. Satisfaction scores, they capture a moment in time. They tell us about how someone felt about a specific encounter. And typically, sometimes that information can be biased from a small sample set. But patients don't live in those tiny episodes. They live inside a longitudinal journey. So when leaders connect experience data with other indicators like employee engagement information, access, delays, safety events, readmissions, referrals, operational efficiency, reputation, they begin to see a much clearer picture. And so then experience becomes a signal of trust. And trust drives everything. When patients return, whether they recommend the organization and whether the community views the health system as a partner in their well-being. Experience data is not just about surveys. It's about understanding the health of the relationship between the patient and the system.
I feel like a lot of times those systems and processes that you described are not designed to foster and enable relationships. Primary and specialty care physicians are seeing 60, 70, 80 patients a week, 15 minutes at a time. And they say, hey, 15 minutes once a year isn't enough time to form a relationship. I'm just trying to get through my checklist and get on to the next patient. And it's challenging for both them and the patient.
And I think it's going to get even more challenging as our population grows and baby boomers flood the market more, and we already don't have enough physicians to take care of the patients we have. Therefore, we're not going to be able to provide care the way that we currently are anyway. So we're going to have to get creative with this whole process.
I want to dig a little bit deeper on that, the staff experience part of things. What approaches have you seen that seem to be working best in supporting clinicians and staff so that they can deliver compassionate care consistently? Are there process changes that you've seen be particularly effective, or what have you seen that you could recommend to us as we think about how to address this going forward?
I'm a firm believer that your patient experience will never supersede your employee experience. Caregivers, they want to deliver compassionate care. Most of them enter because they care deeply about people. But compassion requires energy. It requires presence and emotional capacity. When clinicians spend their day navigating inefficient workflows, documentation burdens, staffing shortages, their ability to connect becomes strained. So organizations that succeed in these patient experience, they focus equally on supporting caregivers. And they do this by building that infrastructure to bring staff and patients together to listen and learn. They then remove the operational friction. They create that safety, and they ensure that leaders are present and listening so that then caregivers can feel supported and patients feel loved, respected, and want to return.
One of the things that many clinicians that we spoke to struggle with is this kind of fee-for-service environment that we're in. And they struggle with this idea of, hey, I'd like to spend more time with each patient, but then I won't see as many patients, I won't hit our targets, and there's these fee complications, and if I saw fewer patients, my compensation is going to go down and all of that. It seems like we maybe have the incentives misaligned. Is it possible to make the kind of operational changes you're describing and free up the time without it impacting kind of fee-for-service revenue and compensation and things like that?
I think there's always process improvement, but we were talking about this earlier, the word process improvement isn't sexy, right? And when you go to your COO or CEO and say, hey, we need to do process improvement, they're like, yeah, go back to your office. We don't have time for this, right? Because it's hard to change the wheels on the bus when the bus is moving, but it's absolutely critical. Now, are we going to be able to solve all these incentives and issues that we're having overnight? No, but it's going to have to go back to the drawing board and look at the different nuances and the friction points that are affecting our caregivers and our patients to see where could we change the process slightly that we could gain the efficiency and then gain economic value back for the organization.
You've described your cancer experience as kind of a turning point that reshaped your whole perspective of healthcare. What lessons can we learn for healthcare leaders, and what is important for them to hear from you on your experience most clearly, do you think?
One of the most important lessons is that moments in healthcare that leaders rarely see are often the ones that patients remember forever. That call that delivered the life-changing news, the silence after a diagnosis, the moment someone feels heard or dismissed. Those moments shape how patients interpret their entire journey. And leaders, they can't personally control every interaction, but they can design systems that support caregivers in those moments. Training, time, emotional support, and leadership modeling all influence whether those moments build trust or if they fracture it.
Transforming healthcare experiences arguably requires challenging, long-standing norms. What kind of leadership courage do you think is necessary to truly humanize healthcare, given what you've observed as both a leader and as a patient?
Historically, healthcare has prioritized efficiency and productivity. Those priorities matter, but they cannot come at the expense of humanity. Leaders must be willing to question processes that unintentionally create friction for patients and caregivers. They must listen deeply to patient stories and frontline feedback, even when it's uncomfortable, and the endless power of and. They must protect the space for compassion in environments that are often under enormous pressure. That kind of leadership, that takes courage and it changes culture.
Now, looking 5 to 10 years ahead, what changes in culture, leadership, or care delivery do you think are necessary to really get the patient experience right? Are there big rocks that we still need to tackle, or are there kind of big issues, or is it different for every organization, or how would you think about it?
I do think it's going to be different for every organization for the sheer fact that we're all designed different ways. And so success will not look like better scores alone. It will look like better journeys. Care would be designed intentionally across departments and people rather than fragmented into episodes. Patients and families would be partners in improvement work more than just a advisory council. Leaders will evaluate success not only by clinical outcomes, but also by trust. And measuring trust in the system is understanding experience and interpreting data across the entire patient journey. From when the patients have their health alarm that they need something, that awareness experience to their interaction experience to how we nurture the experience as a system. And healthcare organizations will also understand something fundamental is that experience is not separate from quality or marketing or financial, operational. It's part of it all. Because when healthcare consistently feels human, we know that we are moving in that right direction because patients will have a better experience, staff will have a better experience, and the organization will gain economic value.
No, I think you put your finger on something really important early on in that comment, and that was all about trust. Because if there isn't trust, the patient doesn't show up for care, doesn't take the vaccine, doesn't stay on the medication, doesn't get the follow-up visit, doesn't get the diagnosis and at an early treatable stage. And so all of the clinical expertise in the world will go for naught if there's not enough trust to bring the patient to the care in the first place.
Yes, you're 100% right.
Let's take a few questions. We have one from Jake Poor. Clearly, we can't give every caregiver cancer to see how it really feels, but how can we effectively give the leaders or employees firsthand insight on what patients experience? Do you have any creative ideas, such as sleeping in a patient room with the door open or something like that?
I'm going to say, read my books, listen to me speak. But we all have this different perspective, and it's all about listening to the stories that people can tell to really understand. Just because I had my experience, people could have a completely different experience through different service lines. And so I really think about building that infrastructure in facilities where you can bring those voices together, where you can talk about what needs to be fixed, what are those friction points, what are we doing well, but then also building in the time to be able to create solutions and actually drive those improvements.
We have another question from Maris Shah. Any real success story that you can share that has transformed providers' attitude and behaviors in delivering person-centered care with warmth, empathy, and compassion, whether it's something you've observed firsthand or things that you've heard secondhand through your work with so many different organizations?
It was very interesting because when I got my diagnosis, my oncologist was absolutely phenomenal. He was just a ray of sunshine. And when he came in and told me 1 week prior I had been a stage 2, and now he told me I was a stage 3, his tone completely changed. And in that moment, I have a whole story about in that moment, but when I came back, I had talked to him and I said, I didn't understand the perspective from a physician engagement way of thought when you think about what our clinicians go through. They go into a patient and they give them life-altering news. And then they go into another room and then they have to turn their brain on in a different way and they have to document. And then they go into a different room and they have some casual conversation. And it's this episodes of just this roller coaster that our clinicians experience. And so how do we give our clinicians time to be human, to actually be able to go through those emotions and turn their brains on and off the way that they need to, but they can have rest, because that is definitely contributing to burnout. I have also seen that when I'm working with physicians, that different physicians are motivated by, you talk about quality, then you can motivate them that way. But then there's some that, have told me that your job is soft and I don't believe in patient experience and things like that. I noticed that there was a book behind you called Compassionomics, and that is one of my favorite books because it puts all the data behind caring. And so I have actually used that book with many leaders, not just physicians, to bring them back into purpose and what the data actually says.
I'm a huge fan of the TV series The Pit because it depicts so, dramatically and viscerally the emotions that they experience and so forth. And there are many who say, don't form a relationship or an attachment with the patient. You're going to need to protect yourself. But what we found in our work is that actually it's the reverse. They need that emotional fuel and roller coaster. They need to feel that connection as well as all the happy endings that go along with that in order to kind of keep themselves engaged and not burn out themselves.
I love that show, The Pit. And I remember one of the very first episodes is they had one of their administrators come down to the ER director, was like, hey, let's talk about your patient satisfaction scores. And I sat there and was like, oh my gosh, that's me. That's been me before.
So here's another question from Diane Gumer. What are some practical ways to roll out improvement communication initiatives when you can't get in front of the entire staff?
One of the things that we did in my past time is that when I was the division vice president for HCA, we had a partnership with Disney. And so we learned how Disney implemented culture. And so if you notice, when you go to a park, whether you're in Paris or whether you're in Orlando or you're on a cruise boat or watching a movie, like the culture seems to be pretty similar. And so they do that by engaging all different staff in all different time zones. And so they have to meet people where they're at. So what we've done is that we would actually ask the staff, how do you want to be communicated with? Your nursing, they might have access to a computer, but they might not be able to check those emails until late at night. Your food and nutrition staff, they might not have emails and might not be interested in doing that. So the best time would be to talk to them at huddles. I've also worked with leaders that said, I need to meet individually with them. I can't do a 30-minute presentation, 30 different ways. So do a one-sheeter information high level with a little video that we can do. So there's all different ways, but you have to meet people specifically where they're at.
I was wondering if you could give us a little plug for your book, Buried or Planted. Can you tell us a little bit what that's about and what readers can expect if they take the time to pick one up?
My book, it was my first year of my journey. When I got diagnosed and went through the healthcare system, I didn't tell anybody who I was. At the time, I was a chief experience officer, and I wanted to see how care really was, because if I said who I was, care would have looked totally different, and hence I probably wouldn't have the book. But what I do is I go through that first year of my journey, and at the end of each section, I call out healthcare to say, here's the friction I experienced, and sometimes I'm like, here's how we fix it, or I didn't know how to fix it, but it should not be this difficult. And I didn't realize the knowledge gap that had existed in myself until I became a patient. And now knowing what I know, I said once that cancer was a blessing for me, and I got beat up on that on LinkedIn. But in my line of work, it taught me something, that lesson that I've learned is what the blessing is.
And I think it also illustrates another important point, and that is that stories are what cause us to feel some of what you experienced during that journey. And no amount of metrics or satisfaction reports or surveys or what have you can have the power of emotion that a story does. And so that's where I think they play a really important role. And we really appreciate you taking the time to share yours. We always like to close the episode with this last question, and that is, do you have a favorite quote you can share with us? And if so, why is it so important to you?
My favorite quote is by Mother Teresa, and it says, if you want to change the world, go home and love your family. What I love about it is that it highlights the small, consistent actions within one's family's home. That means that it's more impactful than seeking grand gestures somewhere else. And if you flip that on its head about a different perspective and you think about healthcare, when your culture is right, healthcare feels like family. Like those are our people. So going home and loving your people, your work family, can also relate to making healthcare a better place through process improvement.
So Stephanie, thank you so much for such an inspiring discussion today. Your journey through healthcare and patient experience, both personally and professionally, is really inspiring. Thank you, Stephanie.